Are you constantly second-guessing your answers on the NCLEX? You're not alone. Over 50% of test takers fail because they don't understand how to answer NCLEX-style questions, even if they know the content. But don't worry, I've got your back. In this video, I'll break down the #1 mindset shift you need to answer NCLEX questions correctly, proven strategies to eliminate wrong answers fast, how to master priority, delegation, and tricky SATA questions, real NCLEX-style practice questions with step-by-step explanations. I've helped thousands of students go from failing scores to passing the NCLEX with confidence. If they did it, you can too. Don't leave your NCLEX success to chance. Hit like, subscribe, and let's dive into the top strategies to pass your NCLEX on the first try. Master the art of strategic elimination for NCLEX success. When answering NCLEX questions, thinking like a safe, responsible nurse is the key to success. Rather than searching for the right answer immediately, pause, take a step back. Start by eliminating the wrong ones. This strategy helps you narrow down choices, reduce confusion, and improve your accuracy. Key principles of strategic elimination. Watch out for extreme words. NCLEX rarely uses absolutes, like always, never, all, none, must, only. Why? Because medicine isn't absolute. There are exceptions to most rules. Patient safety is the priority. The NCLEX is above all a patient safety exam. That means every decision you make should prioritize the well-being of the patient. Ask yourself, does this option delay care, increase risk, ignore a critical need? If yes, it's probably wrong. Think of real-world nursing, but apply textbook knowledge. Some real-life practices might be different from what the textbook says. But NCLEX isn't testing what's common. It's testing what's safest and most evidence-based. If an answer seems right just because you've seen it done, pause, but it contradicts best practices? Eliminate it. Use the process of elimination. Find the distractors, choices that sound right but don't directly answer the question. Look for options that go against basic nursing principles, like restricting fluids and dehydration or delaying antibiotics and sepsis. Case study scenario for strategic elimination. All right, let's set the scene. Imagine this. A 72-year-old patient with COPD and heart failure arrives at the hospital. They're struggling with shortness of breath, their legs are swollen, and they look uncomfortable. The provider gives you a new set of orders, and now it's on you to make the safest decisions. Take a deep breath and think carefully before answering this question. Multiple response select all that apply SATA question. Which interventions should the nurse implement to safely manage this patient's condition? A. Administer 2L oxygen via nasal cannula as prescribed. B. Position the patient in high Fowler's position. C. Restrict fluid intake to 2L per day as prescribed. D. Encourage deep breathing and coughing exercises. E. Administer a high-flow oxygen mask to maintain SpO2 above 98%. F. Withhold diuretics until respiratory status improves. Pause for a moment. Think about each option carefully. Which ones are the safest? Which ones might cause harm? Got your answers? All right, let's break it down. Answer and explanation. A. Administer 2L oxygen via nasal cannula as prescribed. Correct. COPD patients need low-flow oxygen, 1-2 per min. Too much oxygen can suppress their respiratory drive, so less is more. B. Position the patient in high Fowler's position. Yes. Sitting them upright helps with lung expansion and makes breathing much easier. C. Restrict fluid intake to 2L per day as prescribed. Absolutely. Since the patient also has heart failure, too much fluid can worsen pulmonary congestion. We need to keep it under control. D. Encourage deep breathing and coughing exercises. Correct. COPD patients struggle with mucus buildup, so helping them breathe deeply and cough effectively will improve oxygenation. Administer a high-flow oxygen mask to maintain SpO2 above 98%. No. High-flow oxygen can be dangerous for COPD patients. Their lungs hold onto CO2, and too much oxygen can make them stop breathing. F. Withhold diuretics until respiratory status improves. Wrong move. This patient has heart failure, and diuretics help remove extra fluid from the lungs. Holding them? That would only make breathing worse. Strategic elimination breakdown. 1. Spot the extreme words. Maintain SpO2 above 98%. Way too high for COPD. Eliminate it. Withhold diuretics until respiratory status improves. That's actually delaying treatment. Eliminate it. 2. Prioritize safety first. Low flow oxygen, proper positioning, fluid restriction, and lung expansion techniques. These are safe and evidence-based. 3. Think like NCLEX, not real-world nursing. In reality, some nurses might see COPD patients getting more oxygen, but on NCLEX, stick to what's safest and recommended. NCLEX is all about safe decisions. Don't second-guess yourself. Eliminate extreme answers, prioritize patient safety, and trust your nursing knowledge.
By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions and managing the different types of questions are actually taken straight from a resource I really recommend. The new NCLEX-RN Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next-generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this.
Prioritization and delegation, following NCLEX hierarchy. When answering NCLEX questions, it's essential to prioritize patient care based on a well-established hierarchy of needs and scope of practice. This approach will guide your decision-making, ensuring that patient safety is always the top priority. Maslow's hierarchy of needs. Maslow's hierarchy of needs is a psychological framework that categorizes human needs into 5 levels, from the most basic to the highest level of human potential. Understanding this hierarchy is critical in prioritizing patient care. Physiological needs come first, as they are the most basic needs for survival, e.g., breathing, circulation, nutrition. Safety needs follow, which include protecting the patient from harm and ensuring a stable environment. Love-belonging needs are next, which include social connections and emotional support. Esteem needs focus on self-esteem, dignity, and the respect of others. Self-actualization represents the patient's need for personal growth and fulfillment. When prioritizing, focus on addressing the lower levels of the hierarchy first, as these needs are crucial for the patient's survival and well-being. ABCs first: airway, breathing, circulation. Airway, breathing, and circulation are the foundational components of life-supporting care and must be addressed first in any clinical scenario. The NCLEX uses the ABC approach to ensure that the most critical life-sustaining interventions are prioritized. In cases where a patient is facing life-threatening conditions, always address airway, breathing, and circulation before any other issues. Airway. Ensure that the patient's airway is clear and unobstructed. Breathing. Ensure the patient is breathing adequately or intervene if needed. Circulation. Address issues related to blood circulation, such as bleeding, shock, or heart function. If the patient's ABCs are compromised, they need immediate attention before addressing other less critical concerns. 3. Scope of practice. Understanding roles of RN, LPN, and UAP. The NCLEX tests your understanding of the scope of practice for different types of nursing staff. Different levels of nurses and healthcare workers are allowed to perform specific tasks based on their training and education. Here's how you should delegate tasks according to the role of each staff member. RN, registered nurse. RNs have the highest level of responsibility. They are responsible for assessment, teaching, critical thinking, and care for unstable or complex patients. They also handle decision-making and care planning. RNs are responsible for tasks that require advanced clinical knowledge, such as interpreting diagnostic results, evaluating patient status, and making decisions about treatment plans. RNs should handle critical and unstable patients, as well as any situations requiring complex judgment. LPNs generally care for patients who are stable or have chronic conditions. They are responsible for tasks like routine care, reinforcement teaching, and assisting with basic procedures. LPNs typically monitor stable patients, administer medications, and provide comfort measures. They should not be asked to make critical decisions or care for unstable patients, but can handle non-complex tasks with supervision. UAP, unlicensed assistive personnel. UAPs perform basic nursing tasks under the supervision of an RN or LPN. Their scope includes assisting with activities of daily living, ADLs, taking vital signs, and performing non-complex tasks. UAPs are not qualified to make clinical decisions or engage in patient assessment or education. Their role focuses on routine, non-complex activities, such as helping patients with bathing, feeding, and mobility. By delegating based on the scope of practice, you ensure that each member of the healthcare team is working within their competence and training, ultimately providing the safest and most effective care for the patient. In summary, prioritize physiological needs first, Maslow's hierarchy, to ensure patient survival and stability. Address ABCs, airway, breathing, and circulation before any other concerns. Delegate appropriately based on the role and scope of practice of each staff member. RN, LPN, UAP. You're the nurse in charge of a busy hospital unit, and you need to delegate tasks to your team. Which 2Q tasks can you safely assign to a UAP unlicensed assistive personnel? A. Administering oral medications to a stable patient. B. Assisting a post-stroke patient with walking to the bathroom. C. Checking and recording a patient's vital signs before discharge. D. Cleaning and dressing a surgical wound. E. Teaching a newly diagnosed diabetic how to check their blood sugar. Correct answers: B and C. Why? Imagine you're managing several patients at once, and your UAP asks how they can help. You know they're trained in basic patient care, but don't have the clinical knowledge or licensing to perform medical procedures. Helping a patient walk. B. Safe to delegate. A UAP is trained to assist with mobility and basic care. If a post-stroke patient needs help getting to the bathroom, a UAP can provide support and prevent falls. Taking vital signs. C. Safe to delegate. UAPs routinely check blood pressure, pulse, temperature, and oxygen levels. However, the RN must interpret the results and decide if action is needed. Now, let's look at what should not be delegated. Giving medications. A. Not allowed. Even if a patient is stable, only an RN or LPN can administer medications. A UAP doesn't have the training to check for drug interactions or ensure the right dose. Wound care. D. Not safe. Cleaning and dressing a wound requires assessment and nursing judgment, so it should stay with the RN or LPN. Patient education. E. Not their role. Teaching a patient about diabetes, medications, or any medical condition must be done by an RN, since it involves assessment and detailed knowledge. Bottom line, when delegating, always think about scope of practice. UAPs can assist with basic care and routine tasks, but anything requiring judgment, assessment, or decision-making should stay with an RN or LPN.
Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX-RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX-RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and most importantly, help you feel more ready. Good luck. You've got this.